Doctor, I had lifting treatment done at another clinics, but now my face looks more tired and older. Does that mean lifting treatment just aren't right for me? I heard this surprisingly often, and honestly, most of the time, the problem is not that lifting treatment failed. The real problem is this: the lifting treatment performed was not appropriate for your face structure and skin conditions. Because facial aging is not just sagging skin, excessive fat, or loss of volume. Different face aging is completely different ways. Some people age because their skin becomes paper thin, collagen disappears, and the face loses support. Others age because having fat pads slide downward, the lower face becomes bulky and the jaw lines lose definition. And here's the important part: if too much fat is removed from area where the facial volume should naturally remain, the result can actually make someone look older, hollow, exhausted, and even skeletal. Meanwhile, even with the same procedure, when it is performed on the appropriate area for the right facial type, it can make someone look dramatically younger. So today we are going to talk about why some lifting treatments fail, why some people suddenly look hollow after treatment, and how to choose the right treatment for your face. Hello everyone, I'm Dr. Minjung Choi, board-certified dermatologist at Yeongjong Central Dermatology Clinics. And today, we are breaking down the real difference between RF lifting, Ultherapy, InMode, ONDA, collagen boosters, and volume restorations. Not based on trend, not based on the social media hype, but based on anatomy, skin quality, and how face actually age. Thin skin aging type. Why do tiny wrinkles suddenly appear everywhere? Let's start with one of the most common aging patterns I see. This patient usually saying like this: "Doctor, my skin suddenly looks crappy while I smile. Fine lines appear everywhere. My face looks tired even when I sleep well." And when you look closely, the problem is often not sagging fat. The real problem is the skin itself has become too thin. I often explain it like this: think about tissue paper versus thick cardboard. A thin piece of the paper wrinkle instantly without even a tiny movement, but thick cardboard, you can bend it much more before wrinkle appear. Our skin behave the same way. After our 20s, the skin loses approximately 1% of its collagen each year, and the skin becomes thinner, weaker, less elastic, and more fragile. So even small facial expression create creasing. That's why this patient often notice crow's feet, smile line creasing, makeup settling into wrinkles, enlarged pores, and lose crappy skin textures. For this type of the skin, aggressive fat reduction is usually a mistake. The priority should be rebuilding skin quality first. And this is where RF lifting treatment like Dermatology, Sunny, Burnumor, and Oligio become incredibly important. This treatment stimulates collagen deep within the skin and helps transform thin, sagging, fragile skin into firmer, thicker, and healthier skin. I often tell patients RF lifting is not really about physically pulling the face upward. It's more about rebuilding the skin so it becomes firmer, tighter, and more resilient over time. One of the biggest advantages, you usually only need treatment about once a year, and once the skin becomes stronger and healthier, then treating the hollow area with filler, collagen boosters, or fat grafting. Create the most natural result, because volume placed into the strong, healthy skin always look more elegant than the volume placed into the weak, sagging skin. Number 2. Hollow, sunken face. I look tired no matter what I do. Now let's talk about another very common problem, the hollow face. This patient often say, my under eyes look sunken, my cheek look empty, I look tired all the time. And honestly, sometimes this happens naturally with aging, but increasingly, I'm seeing this after over aggressive lifting or fat reduction treatment, especially in naturally thinner face when a balloon loses air, it doesn't become younger, it becomes deflated and wrinkled. The face can age in a very similar way. For this type of aging, restoring support and volume is often far more important than removing more fat. Now many people become scared of filler because they've seen overfilled cheek, migrated filler, or filler face online. And honestly, that fear is understandable. So for this patient, collagen booster can be an excellent option. Unlike filler, which physically fill empty space immediately, collagen booster gradually stimulates your own collagen production over time. So instead of looking suddenly filled, the skin slowly becomes thicker, healthier, firmer, and more resilient. The results tend to look softer, more natural, and less obvious. And compared to filler, collagen boosters are generally less prone to migration over time. Of course, if sometimes have severe hollowness, filler may still be necessary. But for patient wanting elegant, subtle rejuvenations, collagen booster can be incredibly powerful. Number 3, the sagging but hollow face. One of the hardest faces to treat correctly. Now this is where aesthetic medicine becomes much more advanced. Some people have thin skin, sagging cheek fat, dim nasolabial fold, and marionette lines, but also have hollowness beneath the eye and the cheekbone. And this is exactly where many treatments go wrong. Because if you only focus on removing sagging fat, the face can suddenly become hollow, sharp, skeletal, and prematurely aged. I see this more and more after excess InMode, aggressive microwave fat reductions, or overing strong contouring treatment. So for this patient, the strategy needed to happen in layers. First, restore skin elasticity using RF treatment like Dermatology or Sunny. Then, lift the distended tissue upward using Ultherapy. And finally, reposition distended fat pad structurally, sometimes with thread lifting, to restore smoother contour beneath the cheekbone. The key concept is smooth the facial contour by redistributing volume, moving fullness and sagging area into hollow or sunken area of the face. This creates lifting, contour refinement, and healthy volume preservation at the same time. And honestly, the balance is what separates elegant anti-aging from overdone anti-aging. Puppy face. My face looks completely different in the morning. There's another aging pattern people rarely talk about. Patients who wake up extremely puffy but look much slimmer by evening. These patients often have chronic fluid retention and lymphatic congestion, and over time, that lipid swelling gradually stretch and weaken the skin. Think of repeatedly inflated a balloon. Eventually, the balloon loses elasticity. The skin becomes similarly. For this patient, I especially like combining ONDA microwave treatment with RF treatment like Dermatology or Sunny. Why? Because ONDA can help improve lymphatic circulation and fluid drainage, while RF strengthens skin elasticity and structural support. So we are not just treating fat or skin alone, we are simultaneously improving fat, dermis, and lymphatic circulations. And that combined can make the face look dramatically fresher and less swollen overall. Not every full face has too much fat. Sometimes the problem is swelling, and chronic swelling ages the face faster than people realize. Number 5. Heavy lower face aging. My face feels heavy and droopy. Now let's talk about the exact opposite problem. This patient usually have heavier cheek, deep jaw, double chin fullness, and descended fat pad. And here's the important part. Even if you tighten the skin, the heavy fat underneath still pull everything downward. So for these faces, skin tightening alone is usually not enough. The descended fat pad themselves need remodeling. And this is where InMode, ONDA, and Ultherapy all play completely different roles. Number 6. Ultherapy versus InMode versus ONDA. They not the same treatment. This is one of the biggest misconceptions online. People assume all lifting devices basically do the same things. Not even close. This treatment differs completely in energy source, target tissue, treatment depth, and ideal facial type. So here's the simplest way to understand them. Ultherapy, lifting through deep structural tightening and contractions. InMode, remodeling and tightening through fat reductions. ONDA, overall volume reduction with skin tightening effect. Ultherapy, the lifting treatment. The Ultherapy is probably the closest thing we currently have to surgical style lifting without surgery. Its biggest strength is lifting tissue upward. Focus ultrasound energy reach the smooth layers and creating tiny thermocoagulation points that trigger collagen remodeling and structural constructions. Ultherapy works best for thinner face, structural sagging, jaw descent, and deep cheek descent. For this patient, the key is not removing fat. The key is lifting support upward, and this is extremely important. If you aggressively remove fat from the already thin face using strong InMode or microwave treatment, the result can become hollow cheek, exaggerated cheekbone, and a tired skeletal appearance. So for thinner structurally aging face, especially late 30s through 50s, Ultherapy can be an excellent choice. Some face need lifting, not the fat remover lifting. InMode, contouring, and tightening. InMode uses bipolar RF combined with suction technology. Compared to ultrasound, RF heat spread more broadly and create stronger dermal heating and fat remodeling. This makes InMode especially effective for lower face heaviness, deep cheek fullness, double chin, and puffy facial type. It works particularly well for younger patients, fuller face, and early stage sagging, especially people in their 30s who still have decent elasticity but increasing heaviness in the lower face. However, over-treating thin faces with InMode can accelerate hollowing and aging appearance. So facial selection is everything. ONDA, the gentlest fat contouring treatment. ONDA uses microwave technology that selectively heat the fat layer while cooling the skin surface. The 3mm handpiece of ONDA stimulates collagen productions and can actually be beneficial for hollow or volume deficient face. The 7mm handpiece, on the other hand, helps the contraction sagging fat tissue and promote lymphatic drainage, which can improve facial puffiness and edema. Unlike Ultherapy, which creates focused dermal point, or InMode, which hit tissue between electrodes, ONDA hit broader area more evenly and deeply. Clinically, this makes it excellent for double chin, heavy lower face volume, skin tightening, and contour refinement. And one major advantage, ONDA is one of the least painful lifting treatment available. It also causes far less bruising than suction-based RF treatment. So for patients who are pain sensitive, bruising easily, or want minimal downtime, ONDA is often an excellent option. However, and this is important in very thin face, aggressive use of 7mm handpiece ONDA can still create hollowing, excessive cheekbone prominence, and unintentionally aged appearance. Therefore, ONDA is a lifting treatment in which the practitioner design and technique are extremely important. The future of anti-aging is no longer about removing everything. And honestly, this is one of the biggest shifts happening in global aesthetics right now. For years, the trend was remove more fat, contour more aggressively, sharpen the jawline, make the face tighter. But now, we are seeing more patients who looked over-hollowed, exhausted, and prematurely aged after excessive fat reductions. That's why modern anti-aging is shifting towards something much more sophisticated. At Myeongdong Central Dermatology, we're not removing everything, but selectively reducing only the descended fat while preserving healthy volume, improve skin quality, and structurally supporting the face. Because truly useful faces are not simply tighter, they're balanced, healthy, supported, and harmonious. And ultimately, that's what elegant anti-aging should look like. If this video helpful and understand your own face a little better, don't forget to like and subscribe. I'm Dr. Minjung Choi, and thank you for watching. See you in the next video.